My name is Heun. I'm a consultant psychiatrist and professor of old age psychiatry and general adult psychiatry. And I'd like to talk about mental health literacy and its importance. And in this video, I will tell you my first experience about the problems with mental health literacy, and then I will go through the different parts of mental health literacy and its importance for understanding and training. So my first contact in this issue was when we were performing family studies. So in these family studies, we interviewed, and if you couldn't reach the paper, interviewed the relatives about the mental health problems of their family and friends. What we recognized then is that people were quite good at recognizing that someone has a problem, but they didn't know which problem. So astonishingly, people were not able to distinguish between someone having dementia or depression. So in some aspects, that led them very confused and wasn't very helpful in the interaction with medical professionals. So the concept of mental health literacy was coined by Yorm, an Australian psychiatrist who has worked a lot on this and has become very famous on his mental health literacy studies and the mental health emergency support. So the mental health literacy has the different parts. One part is knowledge, so it's about understanding a disease. One part is about attitude, so being not stigmatizing to patients, but to understand that mental health problems exist and it's nothing that a patient has a fault about. It's not their mistake, and it's a disease more or less than any other else. So the reason why we have so many studies and also these videos in this Mental Health Explained series is that we want to increase the knowledge, the recognition of mental health problems, and in this way increase the ability to communicate and help patients. The last thing is about trying to make the right actions, so that's being supportive, understanding, being able to listen, and to make the right and time and the assessment, and to get help which is appropriate. This can be contacting a GP, contacting a social worker, contacting a mental health nurse, or even a psychiatrist. So in summary, mental health literacy is about knowledge, attitude, understanding, and doing the right things. Lots of research done, and if this mental health literacy can be improved and increased in populations, then people get the better help which is appropriate, and it will help reduce the stigma and problems of mental health in the population. If you want to learn more about individual mental health literacy, just watch our videos, Mental Health Explained. It's a playlist. You can run it through easily, and it will give you the understanding. And at some point in time, we will talk a little bit more about the treatment. Thanks for your interest. And if you want to learn more about mental health literacy, please subscribe to our channel at YouTube, Global Psychiatry Archives. And thanks a lot for your interest, and have a nice day.